Good morning, and welcome to a midweek Mobility Magic session with me, Simon Page, Fascial Stretch Simon. It is a sub session today because I'm not teaching next Monday, but there'll be a session at normal time, 11:30. Welcome if you joined us for the first time, if you've not joined us before, or if you joined us for the second session of the week, that is Mobility Magic. If you did our first session this week on Monday, this will be a little bit of a follow-on. If you did not and you were tuning in for the first time, if you're tuning in on replay, this will be a standalone session. So no worries if you did not do the session on Monday. Please follow along as we go. Today you will need a broom handle and probably a towel as well as the normal bits and pieces we normally use. So lacrosse ball, foam roller. And if you don't have any of those things, and you want to attain them, and then come back to us, there'll be a replay of this session. Hello to you if you're joining us live. Nice to see you in the kitchen there. There'll be a replay session that you can watch afterwards as well. So without further ado, we're going to get into the session. Today it's going to be a little bit of shoulders and neck, as well as some forearm. And we'll try and touch on a few areas that we did last time as well. So I'm going to turn the commenting off. Really great to see you. And if you have any feedback, any compliments, insults, or anything in between, and anything you'd like us to cover in the Mobility Magic sessions going forward, feel free to leave that feedback in the comments section of the video we post after. So I'm going to post that straight after the session finishes. So for those of you who did the session on Monday, this will be familiar. Have a broom handle. We're just going to use it as a little bit of an assessment in a minute, but I'm putting it down now. So today's session, we want to see if we can improve a little bit of internal external rotation. So if you can imagine your back's against a flat surface, could always be on the floor as well. But we want to have our feet walking out about a foot's distance from the wall. We want to bend our knees slightly to about 45 or higher. And we want to have our back flat against the wall. So here we're just assessing whether we have good external and internal rotation of the shoulders, just by seeing if, as we come overhead, our hands start to lift away from the wall. So you might find that you start to do that as you get a little bit higher. So this is a wall slide or a wall angel, call it what you want. We just want to see where our shoulders are. We can also do it if you have a mirror or a camera, just by getting our back nice and flat, aligning our hands, and just seeing how far out we can externally rotate our shoulders and then internally rotate our shoulders without dumping our shoulders forward. So it's just a good reference point for this particular series of stretches. So this can also kind of show you if there's any issues. If you have any localized troubles over the shoulders, this series of stretches can help. The next thing we're going to do is we're going to have a look at internal, external rotation using the broom handle we did last time. So if you grab your broom handle, we're going to do some shoulder breakers. So you can either start the same way we did last time, where we did some shoulder rolls, and just to review, we did one side, just starting off small and localized and then making it bigger. So you can do that one too. And essentially you want to make sure that you're brushing past the ear and then slightly externally rotating the thumb. So faces up on the way up, and on the way out, we're actually facing it inwards towards our ear. So if I step back a little bit so you can see on camera. So as you come around, you're turning it inwards and then turning it in towards our ear on the way down. Thumb comes back up again. Okay, so you could do that too. You could even do some bigger circles too with the shoulder. So that's an option, but this one we're going to grab the broom handle and we're going to start to see where we reach a sticking point. So for myself, I can do a full 360, well, almost all the way around, because I have fairly good shoulder mobility. But for some people, you may get to here. You may only get to the front right here. And if you stop right there, let's say that we want to increase our mobility from that range. We want to stretch our pecs, our shoulders. We're just going to start to reach back in that range, and we're going to start to kind of groove that pattern. So you want to lubricate the joint just a little bit. And we're just going to bring the shoulders to a point where we feel a mild stretch, maybe in the chest, maybe in the back of the shoulder. Either way, keeping the tension across the bar and just going as far as you can, because we want to educate, we want to build some effort feedback in that shoulder, get some sensation, feed the nerves, the synovial joints, etc. Just try and get some motion in that region. And if you find that one side is a little bit more mobile than the others, or a little bit tighter, just bias that side just a little bit, keeping that elbow straight. Okay, so just coming back. You can do that as many times as you need to. It can be a really good warm up or a stretch, just getting you back into those ranges. And if you do it every day, you're going to find that you get a lot more of an opening of that chest and shoulder region. It can be really good for the forearms too, as if you slightly externally rotate your wrists, you might get a little bit of stretch through there. So we're going to cover that shortly as well. So when you've worked yourself to a little bit of a new range, 1% is good. Okay, 1% increase is good. We're not looking for a dislocated shoulder. We'll do some more localized stuff shortly. If you would like to improve that a little bit further, we're going to come down to the floor. So we're actually going to grab our foam roller. So grabbing a foam roller, we're going to come straight down to the floor. This is an orange on orange, so hopefully you can still see it on the floor. But we are going to do a little bit of a stretch. First of all, for the QLs, the low back, you're going to place it half the way on one side of your back. Okay, so halfway on one side of your back. So it's just underneath me here. The reason I'm going to start there is the insertion of the lat is around about the top of the pelvis, connects the arm to the lower body. So we just want to kind of get some tissue diffusion, a little bit of tension out of that area. It's not in any way going to change the state of the actual tissue or kind of release it, but it's just kind of helping to ease some tension, which should help us stretch it a little bit. So just resting your body weight on top of the foam roller. We're just kind of at the edge of the foam roller here, so we get a little bit more localized pressure. And we should find that this back starts to ease off. Now you can spend up to kind of 5 minutes here if you need to, just breathing. And as you breathe out, just let your body weight sink into that spot. And the more concentrated you can get, the more you sink into that area, the more you'll find that you get a little bit more of a kind of diffusion of that tissue in that area. So as we've done that, let's do another couple of breaths. Just sinking in. We're going to stay on this side. We're going to transition our position and we're going to turn our body. So once we're in this position, you can either straighten your bottom leg and bring this top leg across to about 90, or we can just stack our hips. Either way, we're in this corner where we have our teres, major, minor. We have a few other kind of muscles that kind of meet. So lats, serratus anterior, posterior, etc. We also have kind of some of the shoulder musculature that kind of all binds in this corner, and you can even get a little bit of a restriction within the tricep as well, as it feeds under that teres major, minor in that area. So we're going to rest our body weight on top. We're stretching out a little bit, and we're trying just to get our other shoulder to line up over the top. And as you sink down and breathe out, you'll find that the tissue has the same effects it did in the low back and starts to diffuse a little bit, and you should find some of the pressure comes off of the lat, the shoulder, and you get a little bit more opened up. Now, what we can do is we can kind of turn our body a little bit to kind of come across those fibers. If you have a foam roller like I do that has kind of ridges, this can be slightly uncomfortable, but a good experience to release those lats. If you have a flat roller, it can be a little bit more comfortable. So we're reaching up as high as we can. We're just using our hand as kind of a rudder, just kind of coming backwards and forwards, backwards and forwards. And then we're just going to move down just a little bit. And then what I want to do is you can increase the pressure to about 7 or 8 up 10 at this point, just by lifting your hip off the ground with a foot, either in front or behind, doesn't really matter, but we're just lifting the hips up to put some pressure down into the foam roller. And if you get kind of a cricky neck, you can also support that too, or the hand that's on the floor can do the same job, and you're just lifting and putting pressure straight down into the foam roller. Now, for this position, we are trying to increase our internal external rotation, so it's a good idea that we add some in at this point. So we can externally rotate, and that's where we take our hand towards our ear, so we're lifting back and up. We can internally rotate, so coming down to our pocket kind of position, external and internal, and we're going to breathe in, and then we're going to push down into the floor at the bottom position. Should feel it start to move into that armpit a little bit, and it should start to loosen up as we internally and externally rotate the arm. Now, let's reach a little bit further, so you can move further up towards the armpit at this point. So if you can imagine, right now we've covered a little bit of the low back, we've covered a little bit of portion up to where the armpit starts right here, into where that serratus anterior is, a little bit of the teres major and minor in this corner, and a little bit of the triceps that kind of feeds down to the lap. Now we're going to move a little bit further up, and if you want to switch to a lacrosse ball, because that's easier for you, feel free to, but we'll stay on the femoral for now, and then we're going to transition to the other side and do the same things we just did. So we're right at the top right now, we're right at the top corner. This can be really effective for some people and not so much for others, but we're just going to turn our body out just a little bit. Worthwhile mentioning that at this point, you probably don't want as much pressure, but what I do want you to do is I want you to imagine you're doing a bicep curl. So if I turn the body, so you can see we're in this corner, we're pinning it down, and we're just bringing our hand towards our forehead. Bring our hand towards our forehead. So if you're in the right position, you should feel a little light pressure, and now just try and raise that hand off the ground. Just raising it off the ground as you pin that corner. You should feel some tissue at the corner of the scapula, kind of start to stretch, loosen up, and that's all we need to do on that side. So let's transition again. We'll transition to the other side. We're doing the same thing. So I'll move around so you can see. I'll move back a little bit now that you can understand exactly what we're doing. We're starting at the low back. So this time we're on the right-hand side. Right-hand side, low back. We're using the foam roller. We're going to try and get our weight to the side of the foam roller. Get this leg nice and straight if you can, and use the other leg for support, which can then kind of be modified as you go through. We're looking for a 6 out of 10 in terms of pressure. So if you are experiencing any more, then obviously back off. This is self-regulated, so just remember that everyone's different on the scale. And we're just going to drop those hips down towards the floor. So as you breathe in, breathe out. The out breath is when you're going to drop those hips towards the floor. So breathe in. Deep breath in. Good. Okay, so you could do a few more. We could spend a little bit longer like we did on the other side, but I'm going to move ahead. And if you want to spend more time, feel free to. If you would like to, it's a really worthwhile one because it can also help take out a little bit of tension in that low back too. You may want to pair it with a release on the opposite side, or at least laying on the foam roller in the same position to help release, or at least take some tension out of the psoas and the iliacus kind of area around the pelvis. So same thing, we are on our side, we are laying more around our serratus, so kind of up the rib cage a little bit into that corner, and we can use our leg if we want to lift up, or if we want to just use that hand as the rudder like we did last time, we can do that too. And we're just going to sink our weight into, just by dipping our head into that corner, and we're just going to hang out. Now, I'm particularly tender on this one side right here, which tells me that I have definitely worked my lats and serratus yesterday working out. So I'm going to spend some deep breaths here. Just let my body sink. And then we're going to reach across for a little bit of a stretch. And you can also creep this hand along the floor if you want to add a stretch in between on the one side. Now let's raise that hand up to the ceiling and let's just use it as a rudder. Coming backwards and forwards, just shifting our weight across the fibers. And then we can move up just a little bit more towards that corner. So again, if you want to add more weight in, you can just lift your pelvis. You may want to support your head as well if you need to, but now we're moving more towards that armpit. So we're a little bit higher up. This is where that kind of tricep can get bound up. On the backside, the lat can get caught up too, and you may have teres major and minor kind of entrapment there. If it's extra tight, potentially, those could all be things that occur in this area. So same thing, just wave your arm backs and forwards just to shift that weight. You can also lift your hip up. And again, if you want, support your head kind of in this swimsuit pose. So I'm going to lean my body weight forward slightly into that corner because that's kind of where I feel it. I can stretch my hand along the floor to get more of a stretch on the posterior side, and I can rotate again a little bit more. So let's get some internal external rotation on this one side. So external rotation would be, I bring my hand behind my head, less on this side, and internal would be turning down towards the floor, which is where I have a little bit of limitation on this one side, and I can push into the floor as I keep this weight in that area, and then I can sink down as I relax. So I externally rotate as far back as I can, and then I internally rotate and I push into the floor, and as I relax, I should sink a little bit more into that area. You'll find that if you do this kind of PNF type stretch, where you work this end range, you might find that you get a little bit more of a tissue relaxation in that area. So we're going to roll back, we're going to release it. We've done both sides. So let's stand up now. We're going to grab your broom handle that we had just now. So we put our finger away for a minute. We're going to grab our broom handle. Now, if you had any sticking points in the area in the corner, maybe it could be the subscapularis. So what we can do is we can take a kind of shotgun approach here of maybe that could be what it is. If this feels uncomfortable for you, I would say don't do it because it's for some and not for everyone. We're going to put this broom handle down. We're going to imagine that your aim is to get the head of the broom handle kind of up into the corner of your armpit. So hopefully you've put some deodorant on, otherwise every time that you clean the house from now on it's going to smell a bit funky, but that's okay. We are going to sink our weight down into that corner. So the idea here is we're just getting that subscapularis, which can get a little bit caught up. It's the muscle that sits on the rib cage side of the scapula. We're sinking our body weight down just by dropping our hips down, and we're letting that weight of our body push that into the corner underneath our scapula. So if you're not quite sure, you can turn your hips, hit that scapula on the underside, and we're just sinking down. As it starts to relax, we can sink our body weight down. We're not trying to detach our scapula from our rib cage, okay? So this is just a release of the tissue. Now, once you find a good point, we're just going to start to reach away from us, keeping that tissue under tension, and we can bring it back. Release that tissue, sink down again. Again, this broom handle or pole or whatever you have, wooden dowel, is going to sit in this armpit closest to where the scapula sits, and we're just putting some weight into that area. It can be really good if you have like a body pump bar at the gym. Just make sure you clean it because it can be a really good way of capturing that tissue. So we're reaching out, we're kind of abducting the shoulder, sinking down into this armpit. Now, you can also do a little bit internal and external rotation at this point. So I'm externally rotating, internally rotating. So that's going to help capture those last kind of points that we did on the floor when we were kind of reaching up with the foam roller. And if you check your shoulder now, you might find that you gain a little bit more range. So if you were to do the wall slide again, if you wanted to see whether this was something that would work for you, you might find you also increase that internal external rotation. So let's do the other side, and then we'll actually adapt this for a little bit of a chest release too. So side of the top of the broom handle or body pump bar or whatever you're using has to be something that's kind of long enough to allow you to sink your body weight into. This can also work on like a banister rail or something, as long as it's stable. You're going to sink so that it's making contact with that scapula, and we're just going to relax in that position. So if you have any tension there, if it feels uncomfortable, just go to a kind of a 6 or a 7 out of 10. Don't need to go too extreme, and you're just going to hang out and breathe there. Sometimes this is all you need, just to let that area kind of diffuse and feel more comfortable, so you take some of the tension out. So we're just going to let that arm hang. Just going to hang down to the floor, let body weight kind of sink. You can start to reach out. We'll reach out to the sides, we keep that pressure. You should feel the tissue start to ease up as I do this in the corner. If you need to lean forward, lean forward. Just be aware that you need to be very stable to do this and find a comfortable position. So internal, external rotation. So I'm internally rotating, externally rotating, internal, external, excellent. So just roll your shoulders off. Let's just do a quick shoulder roll to see how that shoulder feels. Very often, I find personally that any crunchiness that I have, any issues where I'm quite tight within this area, tend to go away after I do this one particular exercise where I kind of help increase that internal external rotation. So put the broom handle down for 1 sec. Let's do a few circles just to see if that's improved things. And if your shoulders are more silent than they were before, that series could definitely help you, okay? I'm gonna show you another modification or two in a second that you could do for this. But external rotation, a little bit more than it was before, as long as you're not compensating with your low back. Internal rotation, a little bit more than before as well. So let's do another one. I'm gonna release on the front side this time. So we've done underneath the armpit, we're actually gonna go into the pec a little bit more. This time we're actually going to be about 90 degrees, so you wanna get parallel with the ground if you can, or thereabouts, may not be exactly parallel with the ground. Depends how short you are with this. I'm at least 6'1", so this is probably about 4 feet-ish, 4.5 feet, something like that. So you wanna bend down so that you're getting it on the pec, the corner here, that pec minor area. So a little light pressure, here. We're gonna internally and externally rotate that shoulder. So very light pressure. This time we want about a 5 out of 10. Doesn't need to be a lot, because what we're not trying to do is dislocate anything. We're not trying to cause any damage. It's just a light pressure to help internally, externally rotate our shoulder. So if you can imagine, it's just this motion with just a gentle Queen's wave, that we're doing right now. So you're gonna turn, so you can see we're externally, internally rotating. It's in the corner, it's not too much pressure, it's enough so that I feel it, a little light stretch. And a little external rotation, so you're just kind of pushing away from you. See if that feels any better for you. See if that helps increase your shoulder range. See if your chest feels a little bit more open as well. I often find that you hit this corner, bingo, you release a little bit of tension there, you get a little bit more shoulder range and chest. So we're just gonna internally, externally rotate, internally, externally rotate, internally, externally rotate. We're just rotating in and out. Little light pressure again, 5 out of 10. See how that shoulder feels now. We're going to return to a little bit of external rotation with the bar. Just see if that's improved too while we're here. And then I'm going to give you another external rotation exercise. So we're going to take this bar, you can hold it in your hand, or this broom handle if you have one, and we're going to turn it up the other way. So I've just come to parallel and I've turned it the other way around and brought my shoulder, so now it's kind of pointing up. Okay, so this bit's the bit where sometimes the clients tend to lose it, but I'm just going to show you one more time. So if I'm going to throw it, this is the position I want to be in, and I'm just going to grab the bar from underneath. So we're going to increase our external rotation a little bit more by using this pole. And if you don't have one, unfortunate, but feel free to follow along when you do. So we're going to pull this bar forward. So I'm just lifting this up slightly to increase external rotation, and I'm going to back off. So it's just a light stretch, light stretch, light stretch. Don't force the shoulder. You don't want to be in pain. Just a light stretch in that shoulder. Make sure it's in line, and then we just return again. So it's a stretch, and now I'm going to offer resistance. Don't break your broom handle, obviously. Just a light resistance, and then I'm just going to relax and let that external rotation take hold. I'm going to do the same thing on this side. So imagine that you're throwing a javelin. We're going to bring that, on the run up, we're going to bring that pole back. We're grabbing the handle. We're going to externally rotate. So again, if I was going to throw it, I'm just going to grab it from underneath, and now it's behind my shoulder, and now I'm externally rotating by pulling the bar forward. I'm trying to keep my elbow straight, so you can see, and then just lifting it slightly so I get a stretch. As long as I keep my shoulder blade behind me and not let it kind of glide round, then you're going to get a good stretch on this one. So lifting up and then just relaxing. So I'm lifting up and relaxing. One more time, lifting up. I'm going to push away, so I'm having to fight without breaking the broom, and then I'm going to relax. So pulling up and relaxing. Now it's worth another check-in. So here's where you may want to do a little bit of a check-in on the wall. So we did that wall slide at the very, very start. This is helpful, again, just to address to see whether you have any asymmetries with the shoulders, anything that's kind of worth correcting. We have a whole series of these videos online, or you can message me directly and I'll see if I can scrape something together for you. So, back flat against the wall, arms against the wall. We want to be at about 45 degrees or more, but at least a foot length away from the wall. And we're just going to slide up the wall, see if our shoulders now stay on the wall, or if there's less noise in the joints, or if you may get your wrist come away before, maybe you don't now. But either way, if that feels more comfortable, hopefully we've done our job with that one. So you can do a little bit of neck work now. I mentioned before you might need a towel. So we're gonna, let's finish off with a little bit of a shoulder stretch. Actually, this will probably help some people to finish off with that internal external rotation. So let's just do that for a sec. Grab any towel or band, I'll show you both. We're gonna bring this down our back. So if you can scrub your back this way with a loofah, fine. If you don't quite have this range, pick something long, like a longer towel. This is actually quite a short one. It's probably in the length of my body, but we're gonna bring this behind us, okay? We're gonna bring our other hand to the base of the towel, and we're going to kind of floss the two. So I'm externally rotating this shoulder, my chest is open as possible. I'm lifting this hand up to the ceiling, so I'm kind of doing this motion, I'm doing that soaring action. I'm lifting up, trying to get this hand across more to the midline opposite shoulder, and I'm opening my chest, nice and tall with the chest. I'm not compensating through the back, I'm getting a little nice stretch. Now, if you'd like to take this one step further, what you can do is bring your head down towards your armpit, give it a nice big sniff. And now stretching a little bit more into that shoulder. And I can do a little teapot as well, just a small one, just to add a little bit more of a stretch into the upper back. So let's just return. We can pull down, so pulling the towel down, you get a little bit of an open chest stretch here, pulling down to the floor, lifting up. Okay, so let's switch. Now my left hand, which is my shoulder that has more range, is on top. My right shoulder, which is my tighter shoulder, everyone has one, is in the opposite position, and we're doing the same thing. So we're just getting up across our back towards our other shoulder, and if you notice I'm a little bit lower on the sides, a little tighter shoulder. I'm trying to externally rotate this shoulder, trying to keep my back and chest as proud as possible. I'm lifting up to get a little bit of a stretch at my shoulder. I'm trying to push and leverage my back as well as I push this arm into my back. And I'm lifting with this left hand up towards the ceiling. And now, if you feel good, you can take a big sniff, head down a little bit, and you can add a little bit of a teapot lean. If you look, I'm just going a few degrees. Often that is all you need to help with the stretch through the shoulder and the neck. And again, just make sure that your chest is nice and open. We're going to pull down with this bottom hand and just keep this chest nice and open. And then I think we've got time for a little bit of a chest stretch, a neck stretch. So we'll just do a little bit of traction for the time being. So I often like this one if I've got a little bit of neck tension. We're just going to pull the towel forward. So I'm just going to switch to a band so you can see a little bit better. It's a little bit longer. This is why sometimes a slightly longer towel is useful. But don't worry, this is just a band just to replace the towel in this demonstration. So we have a little bit of traction forwards and upwards. It doesn't need to be overly aggressive, it's just a gentle traction. These are cervical spine, cervical discs that we're dealing with, and they don't like a lot of abuse. So just lifting up, so you're tractioning forward, keeping our chin tight, we're just tractioning up slightly, arms are straight out in front of us as best as possible. We're tucking our chin and we're tractioning forward, slightly up, and relax. It's just a gentle traction forwards and up, making sure that everything else in our body is nice and tall. You can even do this one seated if you wish. I would probably just get a 6 out of 10 in this one. You want to be gentle. This can also help to loosen up that tissue in the shoulder as you raise up and you're tractioning. It can help to separate or at least take tension off that tissue as that shoulder feeds into the neck back here, because shoulder and neck are connected. I want to get rid of that tension. So next thing you could do is bias one side up, one side down. So we're just tractioning forwards, and then we're just lifting slightly, so it look like this from the side. Tractioning up, and down. And then we're tractioning forwards. Again, this is just to replace the towel. So if you're tuning in right now, you probably always use a towel for this. Traction forward and up, or up and forward, and relax. Last thing you want to do is make sure that you do it a little bit still. So we covered off some pieces for the shoulder in the last session. You can find that in the replays. You can do some kind of crab position, but we'll do the neck because that's the one that we just worked. You can start with a little bit of a static hold, pushing our head into our hand this way to the right. This will also help that shoulder if you open your chest up a little bit. So if you're in this position, this can also help that shoulder on the back side. And we're just pushing our head into the hand. Not too aggressive, about 6 or 7 out of 10. We do the same thing. I'm gonna push head into hand and relax. Push head into hand and relax. So we can do some circles just to check, and then we can just see what our shoulders are doing. So hopefully that feels good. Hopefully you feel a lot better for those of you that stayed tuned in. And if you have any comments, insults, anything you would like us to cover in the next few sessions, I will be back, not next week, but the week after. And if you have anything you'd like us to cover, you can leave a comment on the video afterwards that I post. Otherwise, that is your midweek Mobility Magic session for this week, and I will catch you soon. See you soon.